Today we are working on a hamstring case. This at the late stage of rehabilitation. We're going to have a focus on muscle strength. The client has a high training frequency as a university athlete, and they have a high training age, meaning they are ready and capable to do the exercises shown. We're focusing on RDL as our main exercise to strengthen the hamstrings. We're going to aim for 6 reps at 85% of the 1 rep max, with around 3 sets and 2 to 3 minutes between each set. The client will be at the stage of healing past proliferation, so they may be experiencing scar tissue formed by type 1 collagen in the area where the hamstring was injured. The RDL is a bilateral exercise, meaning it's working on both sides of the body, or both limbs, and is a hamstring and glute intensive exercise, but also can work the posterior chain. After providing a demonstration, we're encouraging the client to hip hinge. Due to their high training age, they should know what that is. Bend their knees and imagine that they're trying to close the door using their bum. This is just cueing them to push back through the glutes. We want to encourage the client not to round their spine and not to go too far down with the movement. As the further down you go, you're encouraging more muscles to take place instead of it being a focus on the hamstrings. So it's important to check in with the client, also gain verbal consent if they need adjusting through the movements. But due to the fact of being late, we shouldn't really focus on our client's pain scale, but more the quality of the movement. We want the tempo for this exercise to be slow and controlled throughout. Here you can see the practitioner checking in with the client. The client saying that they found the exercise easy, so we'll move to a progression. The progression that we'll be moving on to is basically increasing time under tension, and this would be an eccentric overload movement. The eccentric overload will help improve the muscle control and flexibility around the joint, whilst also strengthening the ligament and tendons in the surrounding area. The practitioners encourage the client to do a count to 5 on the eccentric phases in 1, 2, 3, 4, 5, and then back up. We'll go for 6 reps of 3 sets of this. Here the client and practitioner can build a relationship and have the practitioner count the 5 for the client, just to ensure they are doing the exercise correctly by causing the correct amount of time under tension. As it is the late stage, we want to build strength for the client, but they're just not quite ready for sport specific movements, so that's why we'll keep the exercises bilateral, as adjusting focus is on improving general strength in the area. Now that the client is nearly finished completing the exercises, the practitioner will just check in with them after they've completed the last 2 reps. The client is now saying that they found the exercise easy and that they're ready for a further progression. For the next progression, we'll still stick with RDLs, and it still will be a bilateral movement, but the practitioner is going to show them that we'll place one foot just in front of the other, hip width apart, and just keeping a normal pace tempo, not focus on the eccentric overload anymore. But this ensures that the movement is still bilateral and both hamstrings are still getting work, but it's placing more of an emphasis on the front hamstring. As the client is returning from injury, there could have been some previous atrophy around the surrounding muscles and the hamstring, and these exercises will help improve muscle imbalances in the hamstring. We may drop the weight slightly down to around 70% of the 1 rep max, as we don't want to cause an overload if there is an imbalance. But we'll still go for 6 reps of 3 sets with 2 to 3 minutes in between. Due to the higher intensity of the exercise, the client may say that they are starting to feel pain or it's too difficult for them, and we'll provide them with a regression. Instead of doing a Romanian deadlift, we'll move to a trap bar deadlift, as it's less hamstring focused but still sport specific, so the client will be getting a benefit for doing the movement. This exercise will be less hamstring intensive but still will work on building the lower body strength. As it's a regression, we'll want 6 reps of 70 to 80% of their 1 rep max, and we want the client to have a neutral spine, feet shoulder width apart, and the key focus is bracing on the lift also setting themselves while at the downward phase to ensure that the movement is controlled without. Now a further regression for this will be the hamstring curl machine, as you can work on the tempo and the weight, and it can be a bilateral or unilateral movement to help work on the client's hamstring strength.